Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Marketing Manager Rachel Rum. Today's episode is the first in a special two-part series in which we discuss one of the silent side effects of the COVID-19 pandemic, an increase in drug diversions. Well, welcome, Terry. Thanks for joining us in today's episode.
Great. Thanks, Rachel. Glad to be here.
For sure. So today's topic came up because I think we recently spoke about one of the silent side effects of the pandemic that we feel really deserves a bit more attention, drug diversion or diversion. I think we have all, unfortunately and, sadly seen the articles over the last 2 years that mention nurses, physicians, and really just clinicians in general that have fallen into substance abuse and, subsequently died as a result of some of the stresses brought on by the pandemic. What have you seen?
Yeah, I think you're spot on. Unfortunately, diversion and substance abuse has been something in healthcare we've had to deal with for years. But I think since the pandemic, we have seen a lot more of this. And if you think about it, healthcare providers are compassionate people. They want to take care of patients. They want to see people get better. And with the
Absolutely.
long hours that they were having to work or that we've had to work through the pandemic and just the acute morbidly sick patients that we've seen has taken a toll. And not to mention in the pandemic, their fear of possibly getting the COVID and what they've seen happen to patients as well.
Sure.
So I think that's increased the stress in what was already a stressful job.
For sure, for sure. Yeah, and I think we've seen these articles, but how much attention mental health and healthcare professionals are really getting together may not be as much as we would like it to be. So that's definitely why we're having this conversation today also. But I really want to get into drug diversion. So first of all, I think it's important to mention that we're pretty much strictly speaking about drug diversion in the hospital setting. So I want to ask you why you think we've seen this increase since the pandemic. I know you touched on some of those stresses, but can we elaborate a little bit more?
Yeah, definitely. If you think about um, three things really: access,
Yeah,
healthcare providers have access to these meds, the stress that has increased, and then let's just be honest, the shortage of healthcare providers.
sure.
So we've seen as the pandemic has gone on, we've seen a shortage primarily of nurses, but with all nurses, respiratory therapists, others, but those two are primarily where we've seen a lot of shortages. And because of that, you've seen traveling nurses, the need for and the availability of traveling nurses increase. And
Mm,
in the past, traveling nurses, not all traveling nurses are bad, don't get me wrong, but
sure.
with nurses that go around and travel and do assignments like that, they may not, although they're vetted, they may not be familiar with the organization and the practices of what's going on. And so one of two things can happen. They can be the people that potentially are diverting drugs, or they could be the witness, so to speak.
The travel nurse piece is really interesting because it's not something that I had really considered before, and it's that thing about you don't know who those people are well, that it's that vetting process. Is it how much time is really being spent on the vetting process? Because right now healthcare systems are just looking for people that can do the job, get in there and fill that void, especially after Omicron. I mean, the staffing crisis has been insane. So it's definitely an interesting point of view, kind of like a blind spot that I don't think we're seeing. So let's talk about, the impacts of drug diversion. I know that they can be costly, and, just really lasting. So is there any way that hospital executives can be proactive against drug diversion and just, talk to me about some of those impacts of it?
If you think about the impact, there's obviously number one, patient harm. There could be if you have drug diversion and you have a impaired provider, there could be negative patient outcomes. So you have patient harm, you have potentially negative reputation for the health system in the
Yeah.
community.
Mm.
That is a negative outcome. And then there are the legal implications and the liability to the hospital if there is any diversion, whether it's liability from a regulatory agency or from a negative outcome to a patient. So
Yeah.
those are some of the. There are others, but those are the big three or four that come to mind.
For sure. Yeah. No, those, I mean, those are big, huge, just regulatory in and of itself and that patient safety factor. If we're not keeping our patients safe, then, we're not doing our job at the end of the day, right? So that makes a lot of sense. And it's definitely something that hospital executives should be aware of because these are big issues that are impacting the entire system or the entire organization, right? Awesome. Well, Terry, thank you so much for your time today. As always, you provide some really great information to our audience. And I really appreciate you kind of shedding some light on drug diversion and pointing out some of the potential blind spots or just, factors of it that our hospital executives may not immediately see and pointing out why it's important that they do see it. So I appreciate your time.
Absolutely glad to be here. I think this is one of the things when the pandemic happened, we didn't really foresee this was going to be a problem. But hindsight's always 2020. I guess the good news, Rachel, is that it's not something that's brand new. It's something that is more acute now, and we're seeing it in different areas. But we know the tools. We have the tools to help prevent this or to lessen it, and we just need to figure out how to best implement and use those.
For sure. Well said. Awesome. Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.